Cora Physical Therapy presents an Active Tracks All Access Pass to Preparing for Primetime on Varsity Sports Network.
Hello and welcome to Preparing for Primetime, powered by Cora Physical Therapy here on the Varsity Sports Network. I'm your host, Bobby Latmore. It's been an educating experience doing this show, learning about the different types of injuries and how medical science has developed better surgical and rehabilitative techniques to get athletes back in the game. One of the injuries that many athletes suffer is an MCL injury. There are different levels to an MCL injury. Some are diagnosed with level 1, 2, or 3 grade sprains, but worse is the tearing of the ligament. The medial collateral ligament, MCL, is one of the 4 major ligaments in your knee that control the movement from side to side. Some injuries occur when the knee is slightly bent, often landing or bending in a wrong direction from jumping or even walking and turning your knee in a different direction than where you want to go. Other times, the injury takes place from direct contact to the knee, from equipment being thrown, or even helmets hitting that part of the knee area. No matter how you injure the MCL, it is very painful and you won't be able to walk on it for a few days depending on the severity of the injury. Most level 1 and 2 grade sprains can take up to 2 weeks to heal. If your injury is more severe with partial tearing, you more than likely have to go through some type of surgery to repair it. When we come back, we'll check in at the Cora Physical Therapy Center in DeLand to see what types of rehabilitation is being done to get athletes back in the game. You are watching Preparing for Primetime, powered by Cora Physical Therapy on Varsity Sports Network. Welcome back. One of the fun things we get to do on this show is to get out and visit with the athletic trainers at the different Cora facilities around the state. Today we're heading to DeLand to check in with the great staff and some student athletes going through their rehab at Cora Physical Therapy.
Hi, I'm Summer Taylor. I am the clinic manager here at Cora Physical Therapy. Our facility is a primarily orthopedic facility. We see a variety of orthopedic conditions here, both pre-surgical and post-surgical, and then also non-surgical cases. We have a full-time athletic trainer on staff that helps us treat our athletes a little more well-rounded. And we also have a full-time physical therapist and multiple physical therapist assistants that help. We offer physical therapy, athletic training. We have some specialty services that we also have resources for the aquatic therapy. And we also have an Alter-G, which is an anti-gravity training system that we use. We have various self-pay programs that help with athletic power and performance. Those are mostly utilized for patients who don't necessarily have an injury or are coming off of an injury that they've already been rehabbed for. We work with a lot of the high schools in the area, primarily DeLand High School and University High School, but we also have a high school up a little north of us in a more agricultural area, Taylor High School, and we do a lot with them as well.
My name is Jameg Munjing.
What number are you at Deltona?
Number 10.
And you play what position?
Slot receiver.
You miss it, don't you?
Yeah.
Have you played any this year so far?
I have actually. I came back playing
Right.
because I thought the injury was gone.
Right.
And 2 weeks into doing the workouts and getting back on the field, running full speed, and I realized this is not gone.
Right.
The pain came right back.
Right. So what initially happened? You said you heard it in the spring, so what happened?
So actually, a couple weeks before that was track districts, and in track districts I was running the 200 meter, and while I was running that, I actually strained my hamstring, but it wasn't really that bad. You know, it was tolerable pain. I finished the race, and afterwards I was like, dang, my leg hurts. So I recuperated, I iced it, did all that kind of stuff, and then a couple weeks later, spring football came around, got a jet speed. I was running to the outside to try to beat the linebacker coming, and pop. My leg just it was almost like it stopped in midair, and I just went flying.
So you actually felt it pop?
Yes, it was almost like I heard it.
Really?
Yes, sir.
Feel a lot about and stuff like that. You almost hear that and feel that pop that happens back here. Obviously, which leg was it?
My right.
So your right leg, did it ball up any as a tear happened or anything like that, or is it just, did it really?
it was immediately like pop, and it was like I left my leg behind me. My body went flying, and I just went skidding across the ground. And all my defense came up to me, they were like, "What's wrong with you?" Like kind of like you just stopped running.
Yeah.
No one touched you or nothing. You just went on the ground. And my coaches came up, and that's when they realized something was wrong. And they're like, "Take him to the sideline. How am I gonna be if I break out? Am I going to be able to pick up the speed and get into my second gear?"
Well, talk about coming here, the Cora Rehab Center here in DeLand. Good place to go, huh?
Oh yeah, definitely. I really enjoy it. Like the people here, they're really friendly. Always checking up on me, seeing how I'm doing, and it's enjoyable. It hurts, like physical therapy isn't always fun, but they make it enjoyable here.
Right.
Definitely.
So where are you right now as far as your return?
My return is 50-50 right now because the sport I want to go to college is track. So as of right now, I don't know if I'm going to be able to come back 100% for football.
Right.
But track is looking pretty good right now at the rate I'm going. So I'm working, and I should be. We'll see.
Well, fantastic. What did you feel you didn't stretch right, or do you feel you just didn't get enough into it? I mean, what was going on there?
Actually, I feel like I didn't stretch right. I told the coaches the whole day. I was like, "Hey, coach, I have a knot in my leg." They're like, "Oh, go stretch." Stretch for like 15 minutes. Stopped. Went back into the game, like practice, and I was like, "This thing is still here." They're like, "Go stretch." Eventually, they got tired, and I was like, "I'm tired of asking. I'm just gonna stay in." So, got jet speed to the left. I mean, the right, and then my jet speed to the left. Bah. It was just like right where that pop was. It almost felt like it was moving around in there. Just poof. And a pain I never felt before in my life. And then
you're a senior this year?
Yes, sir.
You said track. What offers? Do you have any offers right now on the table or not? Not yet.
I actually got reached out from my first college track recruiter.
Right.
So that was pretty cool the other day. So that's looking pretty good. And my grades looking good. My test scores are getting better. So college is looking good.
Morgan Levesque.
What grade are you in?
10.
So you're a 10th grader. What sport do you play?
Softball.
So you play softball. So what happened?
A couple years back, I had a bat with a donut on it, like the weighted donut on it, and I dropped it on my knee, and it started pain my knees to be messed up when they grew. So I have patellar tendonitis, which is problems with the tendons that we're trying to stretch out and stuff. Playing games in between, but trying to take as much off of the games as we can to help build the rest, so that way it has time to heal completely. Depending on how therapy goes, if it in the spring, and if not, then we'll be having surgery, and I'll have to be out for 3 months at least. It's a very happy place. They always encourage you to do better and help you, even though it's in pain and stuff. And they just give you that sympathy that you need.
Madison Humphrey. I'm in 11th grade, so a junior. Deltona High School softball.
You play any other sports?
I do weight for my ACL, but I continued playing through the entire season, and then I had to get surgery on July 25th.
So you kept playing?
Yes, sir. Yeah, I wore a brace. Yeah, I didn't want to get taken out because I just wanted to keep playing. So.
Well, that's something that a lot of kids your age do. I find it commendable, but also it's kind of scary.
Yeah.
Because if you really would have hurt something later, what would have happened?
It would have made it worse. Yeah.
So you had surgery when?
July 23rd.
And you're still looking to come back when?
End of November.
There's no way. That's unreal. Congratulations. That's awesome.
I want to go to college and play softball, of course, but I want to major in business and cosmetology. I was injured. I had colleges looking at me, but once I told them, they said just keep us updated. They didn't really
They'll do that, but you know what? If you come back in November, they'll be right back on your front door.
Yeah.
You are watching Preparing for Primetime, powered by Cora Physical Therapy on Varsity Sports Network.
Jim Miller.
What do you do here at Cora?
I am a certified athletic trainer. I'm also licensed, and I'm a performance enhancement specialist. And I just recently got certified in TPI, so golf is Titleist Performance Institute, and they have a golf certification that we can get golfers in, analyze their swing, help them correct any deficiencies or bad movements that they have, or any injuries that they have.
Now, that doesn't have to be a rehab guy. You can come in for any of that, right?
Anybody
so
off
me?
the street. So you could come in, we could take a look, do an assessment, 16-point screen, and then give you some...
You need a 26 for me.
some feedback on that.
Jim, talk a little bit about, we saw 2 young ladies in here today. One, let's talk about the patella injury that she had.
Okay.
Explain what she's got and what the patella is, all that good stuff.
Okay. So with that one, she's got an issue going on with her patella or her kneecap that she had a quick growth spurt a couple months ago. So her body's still trying to kind of adjust. So in doing that, everything tends to kind of stretch out and everything starts causing more pain because things aren't where they're normally supposed to be at, kind of a thing. It's kind of an elongated type movement. It's kind of like if you take a rubber band and you pull it taut, it's going to cause more pressure at both ends than if it's loose. So with that, we tend to really focus on a lot of strengthening into the quads, the hamstrings, front of the knee, back of the knee, lower leg, to get the whole area stable and be able to adjust to the body's growth and movements while she's still in that phase to where things, when they finally then, if the growth plates close, then she's not going to grow anymore. So she doesn't have to worry about those quick movements in her body there.
Quickly explain the growth plates.
Growth plates are located more towards the end, so if you look at like the lower leg, her tibia, so that's the big shin bone going up. The part that comes up to where both the knees, the femur, and the tibia come together, there's a growth plate there. So that allows, as you grow, it allows that tibia to form and extend down more as your body adjusts to that. So that allows you to be able to grow. It depends on how tall you are when you grow. So a lot of times if you get an injury to that growth plate area, or if you have procedure done, sometimes it can either close the growth plate or stint it to where the leg will either stop growing or the joint just closes prematurely. You never want surgery to be the first option. You always want to rule out, do therapy, medicine at that point, MRI, X-ray, go on from there. You want surgery to be that last option because you never want to go to somebody that wants to cut you up first time you see them. Because there's instances that you don't need surgery. Sometimes everything could be corrected through therapy. It could be a biomechanical issue. There could be an imbalance in the hips causing knee pain or foot pain, that sort of thing. So surgery at that point would have been pointless. So she had ended up tearing her ACL back in, I believe, February. She was doing a play. She ended up, I think, hyperextending or tearing. And then she kind of put it off because she was still in the height of her season and didn't want to get taken out and be out for the rest of the year. So doctor then prescribed some prehab surgery or prehab strengthening before he decided to do the surgery. So that way there we could build up the musculature in the quads, the hamstrings, all the legs, get that stable to when he does the surgery coming out. Rehab is a little bit faster. But this doctor's got a very progressive program compared to others that we see. Other doctors, everything that we did today with her would be 6 months down the road, where she's only maybe a couple months out. And he's like, I want her doing this and this. He's like, I gave her extra suture. I tightened her up really well inside, used extra like high tensile strength material. And we were all like, is he serious? Like at this point he wants her doing this, and she's been doing it. She's been doing really well. She hasn't been having that many issues. Prior to the surgery, she was having a lot of issues because of that ACL injury. And that ACL is the ligament in the knee that helps prevent that. Your tibia is here, your lower leg, your femur is up top, and it prevents that knee from shifting forward. So a lot of times it creates instability. So they're able to run forward. As soon as they go to pivot, the knee feels like it just wants to slide right out. So what he did was very advanced from what we're used to seeing, and quite frankly, we're seeing really good results with her so far. So I think today he wanted us to kind of discharge her and then progress her into a fitness program that we offer for a lot of our patients, to where they can continue coming in and working out once their doctor's like, okay, you're good. You don't need to be doing therapy, but they're like, I kind of like going there and working out and being around with the environment that's here. And so we discussed that, and she's going to talk with her parents, and most likely they're going to come back and be with us because the doctor then wanted her to go from therapy to personal training, which as an athletic trainer, that's what I do. I deal with the athletes. So I can guide her into the next phase of her rehab to get her back playing for next season.
One thing to keep in mind, not all results are the same when dealing with sports injuries. Some athletes can come back faster than others due to the severity of their injury and their determination, hard work, and dedication to doing proper exercises according to their doctors and physical trainers' directions. If you're having any kind of pain that is keeping you from your activities, seek out medical attention right away. Trying to recover on your own without knowing what the injury really is can cause more damage to something that could have been fixed sooner and keep you out of the game longer than you expected. We'll be back with more Preparing for Primetime, powered by Cora Physical Therapy, after this. One of the great programs that Cora Physical Therapy has is the partnerships with local area high schools and their athletic programs. One of the schools that Cora Physical Therapy works closely with is University High School in Orange City. We caught up with Dr. Perry Revlett, head athletic trainer, and his student training staff to see how this relationship works at UHS.
I'm Perry Revlett. I've been here at University High School here in Orange City, Florida. Again, this is my 9th going into my 10th year at university. I opened this school up in 2010, and so we've had a very, very successful program here at University High School, and with all the people and students and faculty, and having a lot of support. So it's been very, very honorable to be here at the school. When we first came in, like when I came in from Pine Ridge High School, 2009 to 2010, some of my students from Pine Ridge actually got to transfer over to University High School. And a lot of students from this program really didn't know what to expect the first year. Traditional wise, you know, what do we do all the time out there during practices, games. And so the first year was like a live and learn type of scenario, but the ones that I had previously for 2 to 3 years really helped out a lot. So in these 9 years, every year we would bring on maybe 3 or 4 new students comes in. When the seniors leave, we bring in new ones, and so the tradition is, again, teaching the younger ones know what to do. So it's almost like the veterans helps the new ones come in, so it's got to be a very traditional thing here at our school. Well, one way we do it is when my classroom in the biomed program, a lot of times we get into the athletic training, talk about that, what we do, especially with types of injuries that we have to deal with. And a lot of times we'll open it up to them. It's like if anybody wants to apply to go into the program, they have to go through an application process. And then from that process, then we have applications, the students interview them, and they let me know who they think is one of the better ones. And then I sit down with the ones, and then from there we give them 5 days, kind of like live and learn, see if you like it, if you don't like it. And then after the 5th day, then we accept them, and that's when they get their clothes to be on staff, and then we kind of get them into the JV games, not the varsity games yet, because we want them to learn. And so that's how it's got to be a very traditional type of program. Well, number one is, again, I tell them this, it's like it's a commitment. You're being loyal, as it is a time-consuming type of job, and that type of job means you have to be on time, stay till we're done, make sure everything's put away, things are cleaned away. And so from that perspective, they know that cleaning the tables is one of those things, making ice bags is one of those things, sweeping the floor, making sure everything's been taken care of, especially taking the tape off the players. So they know by the end of the game, by the time that they beginning of the game to the end of the game, they know they have to have that responsibility taking care of those athletes. With Cora, they have been very helpful helping me because I am by myself. And Heather LeMasters, who's with me now, who is a super nice young lady, and having a child as she does, and her husband a physician. So having her come in over helps me in many ways. It gives me that little time off, that downtime, just to say, okay, here we had 2 games today, you know, we got another game tomorrow, another game Friday. As again, right now, especially January with soccer, basketball, wrestling, and then we go into baseball, softball, tennis, track. So overlapping really gets to you sooner or later. But having Cora come in and helps us in so many ways, and they've been a big sponsor for us since we've been here.
Doc, what he goes by on campus, has served in the development of other area high school training rooms and is on the board with Kramer Medical Supplies, the leading medical supplier for high schools in the country. University High School and their athletes are very fortunate to have Doc looking out for them when they get hurt. We want to thank Doc and University High School for their time and having us out today. That's going to do it for this episode. Make sure to tune in next time for more sports and rehabilitation training on Preparing for Primetime, powered by Cora Physical Therapy.